Good afternoon, everybody. It's Paul O speaking, and I'm sorry that I might have been on mute for a moment. I'm glad that we are able to join each other today um, for this session that will be devoted towards a follow-up of our myths and questions around coronavirus. My colleague, Dr. Fernando Rivera, was unable to join us today, so I will carry on in his place and update some topics that are relevant in the media. We can't help but being overwhelmed by so much so many stories, so much data, so much information that is in so many sources, and it is sometimes challenging to sort through what is indeed fact and fiction. I'll look forward to hearing some of your questions today as we move through this session. As always, if you'll enter your questions in through the Q&A part of the panel, then we'll be able to address those as we get towards the end of this presentation. My hope is to cover off a kind of a potpourri of topics over the next 30 minutes or so. And if there's certain clarifications that you would like to seek out, then please do highlight them in that Q&A box. If you're looking to do some more reading or want to check on some of the reference sources with a little bit more detail, then I'm sharing with you, here's a couple of places where I am looking. One place is the World Health Organization. I do think that they are a credible source for health information overall, and in particular around COVID-19 and providing some advice for all of us. The other place, of course, is another series of media outlets that I think are providing very good information, and I happen to follow CNN and tune in on a regular basis, and they've done a nice job in curating questions from people around the country and internationally, and I've gone through their sites looking for some information that might be relevant for today's discussion. And there are online sources like this, Medical News Today, and university sites, including our own hospital at UHN and Johns Hopkins, where you will find, I think, a similar flavor to the questions that are being asked, as well as some of the responses that are coming out. Okay, enough of a preamble, and let's dive into some topics now to get us interested. And of course, I think everyone is keyed in on this relevant question. Is there a current treatment for COVID-19? And we've heard some things in the news, I believe. Interestingly, if you go to the World Health Organization site, this is the graphic that you'll find under the coronavirus myths, fact, or fiction. And what they state here, I guess, is partly true. They point out that there are currently no drugs licensed for the treatment or prevention of COVID-19, which is mostly true. They point out, and I'll tell you why in a second, they point out that there are several drug trials. Indeed, there are hundreds of drug trials that are ongoing right now across the world, including several at our own hospital. There was, for a short time, a lot of interest in this old medication called hydroxychloroquine. And some of you may recall that this is an agent that came out of the mouth of the President of the United States. And interesting that the panic, the interest, the flurry of activity that followed President Trump's statement that there may be merit in this hydroxychloroquine to treat or cure COVID-19. What has shaken out since then, because there really was no solid evidence that hydroxychloroquine was indeed a reasonable treatment for COVID-19. Hydroxychloroquine has been available for decades for the treatment of certain immune conditions associated with inflammation. And versions of chloroquine have been used to treat infections like malaria. But there was really no good reason to think it would treat COVID-19 based upon past evidence. But nonetheless, many scientific groups around the world embarked upon well-designed studies of looking at the potential benefits of hydroxychloroquine. And what was found was, in fact, there did not really seem to be an appreciable signal that hydroxychloroquine actually prevented or treated COVID-19. There are still some studies ongoing just to look at other angles on that question. What has been found, and this is actually confirmed previous information about hydroxychloroquine, that if used by people who are very sick, that it may actually cause some various serious side effects, including problems with the electrical system in the heart and potential for irregular heartbeats. And it may lead to illness and even death on its own. So hydroxychloroquine was maybe an exciting possibility in the moment. It doesn't seem to be panning out as the treatment that we should all be reaching for. There are still some studies ongoing that will explore if there is any potential value in the use of hydroxychloroquine. So stay tuned for that. And the World Health Organization bottom line statement that there are no currently licensed drugs in this area is mostly true. The exception, of course, was the interest in the last couple of weeks in this new product called remdesivir. And if you watch the news around the end of April, there was a great deal of excitement that there was actually one positive study around this product that is a drug that actually makes more sense, in that it's actually designed to treat virus infections. In the past, it was used to treat a very severe virus infection called Ebola that you may recall hearing about in outbreaks in other parts of the world, like in Africa. And it was put into well-designed studies in the United States in particular. And what was found that created some excitement from the medical community and even prominent advisors in the White House, such as Dr. Anthony Fauci, was the very early report from the remdesivir study that was sponsored by the National Institutes of Health that indicated an observation from the first 1,063 patients who had been treated with remdesivir or placebo. And I want to just remind you, I'm showing you this X-ray image to say that this isn't a treatment for people that are walking around who think they might have a viral infection, but rather it's for fairly ill people who are actually in hospital with evidence of pneumonia or lung damage that is shown on this X-ray. That's what that white triangle on that X-ray is showing, compared to the other side of the chest where the air areas look rather dark. That's what good healthy lung looks like. This white patchy area represents fluid and infection that is filling the airways of the lung. That's what pneumonia is. And that's what COVID-19 will do to some individuals who have a severe form of the infection. So for these 1,063 people who were treated in hospitals in the United States, half of them received intravenous remdesivir. Half of them received a placebo agent. There were some other drug therapies that were also involved. In addition, everyone would have received good care, like oxygen if they needed it, and intravenous fluids. And they might have even gotten antibiotics in case there might have been a bacterial infection going on as well. Sometimes it's very hard to tell. Those who received the remdesivir treatment, the headline was 31% faster time to recovery than those who received placebo. When you dove further into the data, it seemed that for these folks that were in hospital, the median or kind of the average time to recovery was about 11 days for people that got the treatment remdesivir. And it was 15 days for those who were treated with placebo. So it wasn't miraculous in a way, like if you got the treatment, suddenly you would be up and dancing and running around. Both groups were quite ill. Both groups had people staying in hospitals for prolonged periods of time. And on average, people that received the new drug therapy got out of hospital 4 days earlier than those who didn't receive the therapy. So promising, but maybe not the complete story here, obviously. We would love to see treatments that would be even more effective against the infection and, hopefully prevent people from getting into hospital in the first place, prevent people from getting worse and landing in intensive care units and needing ventilators, and certainly preventing even worse things from happening. So I think people that were quite knowledgeable about this area would have said, this was a promising first step in the drugs that can treat virus. But I think many people are looking forward to the next steps, and the next therapies were available that are in study and that might become available down the road. So in the United States, this agent did get approved under kind of emergency acts in the United States for drug release. But around the world, I think folks are still interested in continuing on with investigations to see if there might be something even better, and looking at combinations of medications that might be able to help us with virus. Okay, so that was story number one around treatments for COVID-19, which I thought was rather interesting. Not that this is a myth, but it is a kind of an interesting, potentially controversial area. And it was kind of sprung forward by something that sort of was a myth in the hydroxychloroquine story. Next up, as the weather is turning nicer, for those of us who are living in Ontario and maybe around Toronto, we've been surprised, haven't we? It looked like spring was here, and then it was snatched back, and now we've been back into winter. But maybe spring will be back around by the weekend. And with the spring comes wonderful parts of our society like mosquitoes. And it's interesting that there are interesting kinds of questions, even myths that have come up, wondering, can mosquitoes actually transmit coronavirus? Now, it's not a crazy question in any means, because we know that there are certain diseases that mosquitoes do transmit in big ways. Some of them are like parasites, malaria, that I'm sure you've heard about in many parts of the world, has a huge toll on the population. And mosquitoes are the unique vector that carries malaria around and transmits it to humans. Mosquitoes are also responsible for certain kinds of virus infections. And of course, in our neighborhood locally, that we know of things like West Nile virus that a few people experience through the spring and summer months. So it is certainly a consideration. However, agencies like the World Health Organization would say, to date, there is no information that would suggest that this kind of coronavirus would be transmitted by mosquitoes. It's similar to the idea that we wouldn't expect to get the common cold from a mosquito bite. We may get other things, but just not that sort of respiratory viruses, because respiratory viruses are ones that are spread primarily through droplets. If I can get graphic, it's the little tiny moisture droplets that come out in our breath, or if we spit and do terrible things like that, and we cough and sneeze, and things come out our nose. Those kinds of secretions, if we are infected with coronavirus, that's the way that it goes, and it's not through these little insect vectors for us. In a related way, it's interesting, the World Health Organization seemed to have received a whole bunch of questions around other kinds of bugs or insects, and they put out a statement that say, even houseflies. I guess somebody wondered if houseflies might be the reason that COVID-19 was being transmitted. And indeed, in their kind of review of epidemiology and literature, that they could find no evidence or information to say that houseflies were responsible for COVID-19. So it seems that the insect world, at least so far, is an innocent bystander in the COVID-19 world. Maybe you've got some questions on there. I know a few are accumulating, and we'll come to them in just a few minutes. Next up, so if we're concerned that infections are going on, we've had a lot of attention around ways to keep things clean, and interesting controversies around ways that we can disinfect. I put up this image of Clorox bleach, not that I'm trying to sell it in any way, but I am highlighting it because it's gotten a lot of attention. Of course, it's maybe the most highly coveted item in the grocery store next to flour and yeast, maybe even more coveted, because I've never seen bleach appear in the grocery store in the last 8 weeks. So bleach is a wonderful thing, as we know, for keeping our whites white, and can complete in the laundry, and it can keep surfaces, hard surfaces like tables and countertops clean as well. But there is absolutely no evidence that spraying chlorine or other kind of antiseptic products like alcohol onto the skin, that this is a good way to kill viruses. And in fact, applying alcohol or chlorine to the body can actually be very harmful. These substances can be absorbed, and if it gets into our eyes or mouth, it gets absorbed very, very well. We know that these things will kill viruses outside of the body because they are poisons. And indeed, if you put them in your body, they are poisons. So do not put them into our body. And of course, we know that where some of the interest in this sort of topic came up, not only don't put them on your skin, somebody asked the question, what if you actually drink it or inject it? Is that a good thing to do? And I just thought that this was, somewhat of a ridiculously but profoundly disturbing concept that you had to have really bright people commenting on it. So at the CNN site, for instance, they posed this question to an infectious disease professor at a prominent US university. And I love the quote to say, "This is a really bad idea. It could definitely kill you. Do not ingest or inject disinfectants like bleach." And of course, I think many of us would have recognized that when the President of the United States wondered aloud during a press conference whether there's a way that we can do something like that, that is with respect to disinfectants, by injection inside or almost a cleaning. He later said that it was sarcastic in nature, but it did make people wonder. It did lead to a plethora of calls to poison centers about this topic. And it led companies like the one that made Lysol products to say, under no circumstances should disinfectants be put into the human body. I think this one will go down into the records of serious myths that needed to be busted in a huge way. And the World Health Organization, of course, had to follow with its own infographic to say unequivocally, spraying or introducing bleach or another disinfectant into your body will not protect you against COVID-19, and it can be dangerous indeed. All right, and on a related matter, people wondered, well, what about the alcohol side of things? Because some people do use alcohol to clean things. Alcohol that we drink is ethanol. I think everyone knows that. There are other versions of alcohols as a family of chemicals. Ethanol is the specific structure of the stuff that does appear in wine and spirits and beer. Methanol, also known as wood alcohol, is another kind of alcohol. It has a different chemical structure. It is used in the garage or in paint cleaning and things like this. You will notice if you ever look at a bottle of methanol that it's got a skull and crossbones on it because it is deadly poisonous. It seemed that the World Health Organization had to say, don't drink methanol, don't drink bleach to prevent or cure COVID-19. Ethanol, of course, is something that people do drink regularly. You may do it for your own reasons, but it's not for the purpose of preventing or curing COVID-19. And of course, if you have too much ethanol or any amount of methanol or any amount of bleach, it can be extremely dangerous. Okay, so staying on the disinfectant theme, here's another variation on the topic. Um, Someone asked the question, how does soap kill coronavirus? And if I don't have disinfecting wipes, can I use soap and water on surfaces? I think the number two most difficult product to obtain in the grocery stores lately has been disinfectant wipes that will deal with viruses and bacteria. So what about soap and water? Because we have lots of soap and we have lots of water. Is that reasonable? And, so what is the deal with soap? Or can I just wash my hands with water and run away? Well, soap is actually very important. This blown up cartoon of what the coronavirus kind of looks like. Oh, and by the way, did you know it's called corona? Corona means a crown. And crown is kind of the shape of these spiky proteins that stick up off the surface of the coronavirus. And that's why it has its name. The spiky proteins stick into an outer layer of the virus that is made up of lipids or fat. Many cells are made this way. Think of like the layer of fat that might be on a soup. If you've made it with some kind of chicken stock or a beef bone or something like that, those fat droplets there are the lipids, and that's the kind of the composition of the outside of the virus. If we think we want to get rid of this virus, the goal will be to break through that fatty barrier and force the virus to break out, so-called guts to spill out, and kill the virus in that way. So if you want to break down that fatty layer that's sitting on the surface of the virus, will water be enough, or do you need something else? And one of the very smart people that answered this question at one of the websites said, imagine coronavirus is like a butter dish that you're trying to clean. And I hope everybody's been washing their dishes well at home. And if you do wash a dish that's been coated in butter, if you just run water over it, you know that it does not wash anything away. So that's why you need some soap, or alternately maybe some alcohol, because these substances are very good at dissolving that fatty lipid layer and getting the grease off of the butter dish or getting rid of the virus. And this is why soap plus water is so important to get rid of the virus that may be sitting on your hands. So that kind of motherhood statement that's been dogging us for the last number of weeks to months, indeed. When you go out and you come back, please wash your hands. If you don't have sanitizer, then soap and water is really excellent. And this is a nice way of thinking about it. Think about attacking those viruses and breaking them down with the soap, and making sure you're rubbing your hands together with all that soap for a good 20 seconds to get rid of all of it, and then washing it all, watch it all go down the drain. That's fantastically empowering, and I like that story. So one of the most important things that you can do for your health is to simply wash your hands with soap and water. And to my knowledge, there is no shortage of that supply. And indeed, I've seen an uptick in the amount of soap that is available in the stores once again. So that's very encouraging. Sometimes you may think, well, what if I go back to that notion that heat might kill the coronavirus? So if I didn't have soap and I just washed my hands with water, but then I dried them under heat, would that do the trick? And the answer, unfortunately, is no. Hand dryers or any kind of other kind of moderate heat that we can actually tolerate will not kill the coronavirus. So the key to this kind of image is, if you washed your hands with soap and water first and you use a hand dryer, that's cool. But the most important step was using the soap and water together. Okay. If you want to move to other parts of your body and wondering whether you should clean those things out, um, does rinsing the nose with saline, that is salt and water mixture, protect you against the coronavirus? And washing out the nose and sinuses has become very popular. I've seen it kind of rise in popularity in the last couple of years, and I do think it's a very nice treatment if you've got congestion of the sinuses that are around your nose and they're all plugged up. And washing them out is actually quite nice to kind of improve the airflow and reduce the congestion. So it might reduce the symptoms associated with that upper respiratory tract infection, but there is no evidence that to say that it protects you against the virus. It's not like you dislodge it from your body. That, if the virus has set up shop in your nose, then it's probably in your throat and in your airways and elsewhere in your body already. So there isn't really a merit in washing out your nose unless it's really congested. Then do that to help your airway, upper airway, but it's not going to get rid of the virus per se. Here's another interesting one, and I thought it's just worth mentioning because it's pervasive and it's very interesting. One of my colleagues, who I respect immensely, introduced this topic to me about 7 weeks ago. And he said, "Had you heard about this?" And and I hadn't at the time, but I looked at it subsequently, and it was kind of intriguing in that there was this sort of sciencey element, but there was also this kind of far out conspiracy theory that was there. And it's interesting that if you bring in a little bit of sciencey sort of bits to it, they think, there just might be something here. And I think this is, quote, a myth that just won't go away. And so this slide summarizes some of the information. I think most of you know what 5G is as the most recent advance on mobile technology. It is visible as a product in the cellular phone towers and the internet towers that are along the roads with kind of these multiple white panels that are at the top of the tower. This brings a great increase in capability for connection of devices through wireless technology. And some people theorize that not only was it spreading internet signals and connection between electronic devices, but perhaps it was also spreading the COVID-19 or SARS-CoV-2 virus all across the world. And there was even a paper from many years ago that said, if we look at how little infectious organisms talk to each other or communicate, there was a suggestion in a paper that bacteria might communicate by electromagnetic signals. Not 5G, not Wi-Fi, but there was this kind of idea that cells might communicate. And indeed, the human body is made so that our cells can transmit signals to each other. And we've had discussions together, all of you on the phone and us, around how our hearts actually have electrical signals that communicate. So intriguing kind of concept. We'll remind you, though, that the COVID-19 is a virus. It's not a bacterium. They're very different in what they do and how they communicate and what happens. And it probably has absolutely nothing to do with 5G. And if you look at the ecology on this or the epidemiology, the original theories that 5G was the thing was that the Wuhan province or Wuhan area was one of the first places where 5G networks were rolled out within China. And they thought, wow, when that happened, that's when the virus happened. But, of course, there's so many other things that just don't match that kind of theory. Like much bigger cities like Beijing and Shanghai, they also got 5G at the same time, but they did not experience these viral outbreaks. And many other cities in the world got 5G and did not have COVID-19 at the time. And then many cities in the world don't have 5G at all, and they are getting COVID-19. So I think it's just one of those bystander phenomenon, interesting theory, but not much substance to it. Okay, but that's part of the myth kind of busting. And the World Health Organization felt that it was common enough and prevalent enough as an idea that they felt like they needed to put something out, a statement about it, saying that viruses cannot travel on radio waves or mobile networks. You cannot video chat a COVID-19 infection to somebody else. COVID-19 is spreading in many countries that do not have 5G. 5G does not spread COVID-19. Okay, so why this is important is that it refocuses on us on how virus does spread. Wash your hands, don't touch your face, keep your distance. Oh, and by the way, if you have a phone, make sure it's clean. 5G doesn't transmit, but your phone might. So make sure you wipe that down regularly. A little bit of alcohol will do the trick. Okay, so many people have been kind of thinking about wearing masks, and from my own view of where I go in my neighborhood, I'd say maybe a third of people are wearing masks. In some stores, it's like 100% of people are wearing masks, and some stores have mandated that. In other stores, it's much less common. But I think all of us are getting a little bit more used to the idea of wearing masks. So unless you have an unlimited supply of masks, you might need to think about how do you extend longevity of these kinds of items. And some people wondered, can you put your mask in the microwave for a few seconds just to disinfect it? I guess it goes back to the idea that heat will kill virus, and that's probably true. Extreme heat will, but just be mindful that if you got one of these kind of surgical masks, and you might have picked them up at the drugstore, for instance, if it's a kind of mask that actually shapes around your nose, there's probably a metal piece in the nose. Or if you've got an N95 mask for whatever reason, there may be some metal embedded into the frame of that mask as well to shape it to your face. Go figure, someone had to make this statement that if you microwave something with metal, that's a bad thing and it'll blow up in the microwave. So don't do that. If you've got one of these surgical masks or N95 masks, actually just setting them aside for hours or a couple of days will allow them to sterilize. It's interesting, people quote a particular study that was in the New England Journal of Medicine from a couple of months ago that looked at how long virus lives on surfaces if you put a whole bunch of virus on that surface. And it said that for things like cloth kinds of products, that probably 24 hours is long enough, and certain kinds of hard surfaces, 2 to 3 days. So this is why there is this kind of underlying guidance that if you leave something alone for up to 3 days, it'll probably be clean by that time, at least virus-free. But if you didn't have virus and you weren't around somebody that had overtly visible signs of infection, then you probably don't have an infected mask. But if you want to be safe, just put it down in a clean spot for 3 days, and then you can pick it up again. So if you've got a couple that you can cycle around that way, then that's one way you can get longer life out of your masks. If it gets visibly soiled, ripped, torn, then it's probably time to throw that into the regular garbage. If you have a cloth mask, of course, you can just wash these out, and just washing it, soap and water, once again, will get rid of the virus. So do that, and you can carry on wearing your masks and wearing them in a healthy fashion. Couple thoughts about other viruses, because this question has arisen a few times, even within our own medical teams, because we wondered when the discussions about coronavirus were starting up a couple of months ago, some people wondered, like, what's all the fuss? We've been dealing with viruses every single year, and every fall and winter is when the time the flu comes. Influenza is the flu virus. And flu is definitely bad. The third bullet here says that from October to April, a 6-month period of time, excuse me, in the United States, between 24,000 and 62,000 Americans died from the flu. So clearly, influenza is a bad thing every single year. And every now and again, it can be a very much more serious issue depending on the strain of flu that is circulating. But what makes coronavirus actually more dangerous than the flu is shown in the other kinds of comments. So bullet number 1 says that more people have died from coronavirus in the US since February than from the flu since October, meaning that the coronavirus is affecting Americans and Canadians and everybody else in the world at a much faster rate than influenza did. And it might be 2 to 3 times more people in the same period of time have died from coronavirus than they have from influenza. So both things are bad, absolutely, but we've been much more concerned about the severity of coronavirus, the number of people that it's been attacking, and the rapidity of people being attacked. And the other kinds of thought that coronavirus is probably more contagious than the flu. Now, for those of us in the wintertime who deal with flu have always been thoughtful and actually used all the physical distancing rules that we're currently using. That is, if someone's sick, try to maintain your distance, wash your hands very well. We don't often wear masks unless we know somebody has a diagnosed flu infection. But with coronavirus, what's been seen is that we need to be even extra careful. On average, somebody with the flu will infect one other person, but somebody with coronavirus will infect 2 or 3 other people. It's more contagious. It can spread more. And coronavirus can be unknowingly spread for more days. And we've heard the stories that people may be carrying virus for many days without any symptoms themselves. So in that period of time, that's when they may be passing it along. When you get the influenza virus, on the other hand, you usually know, and you usually know pretty quickly that you've got the flu. You're laid up with the muscle aches and the chills and feeling rotten, and maybe you've got some respiratory symptoms or some diarrhea and things like that. It comes on a lot quicker with the flu. And the other reason why coronavirus is in fact more dangerous than the flu is that, of course, we have a vaccine for influenza, but we don't have a vaccine for coronavirus, at least not yet. Couple more thoughts and then I'm going to turn you loose. People have wondered, again, as the weather is turning warmer, eventually we'll get to summer, I certainly do hope. Can you get coronavirus from spending time in the swimming pool or hot tub? I think one good rule is you have to choose your bathing partners properly. And if somebody actually has an overt infection, maybe that's not the best time for them to be in the pool or the hot tub with you. So that would be number one, of choosing your neighbors very, very well. But will you pick it up from the water per se? And the answer is very, very unlikely. We know that in good pool maintenance or hot tub maintenance that there will be some additives in there like chlorine or bromine. And I guess pools these days might have salt water in them. But there's so much water to virus ratio that even if there was something, that's very unlikely you're going to pick up virus infections from there. And similarly, some people have been worried about picking something up from drinking water, drinking tap water, and getting the flu from there. But that's very, very unlikely because water is well sanitized. Food, I think our dietitians have done a marvelous job in giving us good guidance about how to eat well at home when you get groceries, and also for takeout. One of the questions that gets asked repeatedly, or one of the myths, is, I will catch coronavirus from takeout. And the answer really is no, as long as you're really sensible about it. Even if there was some virus somewhere, once you drop the virus into your stomach, you've got a great defense mechanism with your stomach acid to get rid of it. But just be sensible. If you're bringing things into your home, it's a good idea to clean up the container, transfer the food to your own plate or bowl, wash your hands before you eat, and you'll do very, very well. And as I said, there's no vaccine for COVID-19. No, not yet, but the headlines, even from this morning, would say there is a race on. There's 100 different possible vaccines being explored. And I think we are all hopeful that one will be available soon and that we can get on with our world. And on the notion of vaccines, some of you will have gotten a vaccine, a pneumococcal vaccine to protect you against bacterial pneumonia, or some of you will receive the influenza vaccine. Well, aren't those good enough to protect you against coronavirus? And the answer is unfortunately not. Both of these things are great on their own, but they treat you against specific infections. Pneumococcal vaccine treats you or prevents you from getting pneumococcal pneumonia. Pneumococcus is the name of the bacteria that is very common in developing a bacterial infection in the lung. And it's also involved sometimes in other infections elsewhere in the body. It's a good one for preventing that, but it doesn't deal with coronavirus. Influenza vaccine is usually very good at preventing influenza, but it doesn't treat coronavirus because they're very different viruses, different shapes. It's important to get both of these vaccines if you've never gotten them before, and get the influenza vaccine every year, because we don't want people to get infections that can be preventable. And this has been especially true in this current time of coronavirus, because on top of coronavirus, we don't want people showing up with bacterial pneumonia or influenza infections as well. If you can't get hand sanitizer, you can make some of your own. And I'm sure you've heard about some of these things. Back to, if you've got some bleach and you want to clean something, very, very dilute solutions. A little bit of bleach, like 5 tablespoons of bleach in a gallon of water, will do the trick to get rid of your viruses. And I'm sure you've all seen recipes like this one. It seems to be very common kind of components of how do you make your own hand sanitizer, using some isopropyl alcohol. This is rubbing alcohol. A little bit of aloe vera gel for consistency. Mix it up in a bowl, transfer into a little container. To give it a little smell, you might put in some sort of fragrant oil, and then you've got your own hand sanitizer. Make sure you label it properly if you are making your own thing. Are there other home remedies that are going to work? And just kind of giving a nod to our last webinar on this, there still ain't something new. Garlic is still tasty, but doesn't help you treat the coronavirus. Drinking lots of water is still a good idea, but won't protect you from the coronavirus. Taking vitamin C is not a bad idea, but won't protect you from the coronavirus. Essential oils, colloidal silver, steroids, none of these things are going to make the difference in prevention or treatment. But washing your hands will. And for some reason, someone asked the question, if you put pepper or other spicy things in your food, will that prevent the COVID-19? No, but it is a delicious idea for dinner. On that note, let me finish off and see if there are any questions. Okay, so number 1 is true or false. Can you get coronavirus through the eyes in the form of conjunctivitis? And it's sort of a true, in that a couple things to disentangle here. One is, conjunctivitis is an inflammation of the lining of the eye, and it's kind of the pink eye sort of story. That's often a virus infection, not coronavirus per se, but it is a virus kind of thing. And you will recall, if you ever get a pink eye, or if your kids or grandkids ever get a pink eye, number 1 thing that we tell them is, don't touch your eye and please wash your hands, because the virus gets picked up. So it's not that the conjunctivitis per se is the issue here, but the concerns around transmission of coronaviruses. If you happen to be someplace where you picked it up on your hands, you've got virus on your hands, and then you rub your eyes, that can be an entry into your body. So that's why the information is, been somewhere, wash your hands, don't touch your face, don't touch your eyes in particular, because that's a portal of entry. Great. Next question is, do we have any insights when lockdown might be lifted? And the answer is, I don't know for sure, but I think we're seeing signs that things are certainly improving. And in our program, we watch statistics every single day. It's encouraging that the number of new cases is going down. We'll watch carefully, cautiously, as there are more contacts in society. So hopefully we can do this in a safe and effective manner, but none of us should lose sight of the motherhood kinds of things that we've talked about. That wash your hands, don't touch your face, keep your distance. If you're getting into a crowded space, wear a mask. All these things are going to apply, whether we're in, quote, lockdown or not. Next question is, how do you do one of these studies, like the remdesivir study or the hydroxychloroquine study? And ethically, how do you do these things? So the ethics would say, if you know something works absolutely well, then how do you withhold it from somebody? And that's a great question. So that's always the question that investigators must ask at the beginning. And if you're truly starting from a place where we don't know, then you can go ahead and say one group will get the treatment, one group will get a placebo or a different treatment. And in the case of hydroxychloroquine, as an example, it was absolutely important that we did these studies where you compared hydroxychloroquine in one group to no hydroxychloroquine in the other, because nobody actually knew whether it worked or not. And you can actually get quite misled if you start to believe, well, obviously this thing works. And if I just give it to somebody and they get better, well, then that's proof that it works. Of course, most people will get better with no treatment, and it has nothing to do with the therapy. So it's very important to think about these studies very thoughtfully, and then moving on further. Okay, a comment that Africa is doing relatively well. Could this be because of the warm climate? And it's actually a very interesting question again, that we wonder the relationship of heat and climate to COVID. And the answer is Africa seems to have done relatively well thus far, with the proviso being that there has been rather limited testing and surveillance. And then if one started looking into communities, that there might actually be quite a lot of illness that we don't know about. And in places like South Africa, where I think we're hearing some of the data emerging, that actually there might actually be a fair bit of illness in the population. Hopefully it won't get so bad, but it is true that it is there. In the Middle Eastern countries, of course, where climates are temperatures are very warm, we've heard of actually a fair burden of disease. And in our South American countries, gosh, we're very concerned. I have colleagues that have family and close friends and coworkers in countries like Brazil. And you may, if you followed the news over the last couple of months, Brazil unfortunately did not have a very rigorous response to physical distancing, testing, tracing. And I think we're seeing actually a fair bit of uptake of conditions in that environment. So that's actually quite challenging. And one of my colleagues actually on the chat is telling me, quote, it's pretty bad there. So it is concerning. And so we're hopeful that we would have wished that some parts of the world would have been protected, but it doesn't seem to be the case. And it might be that where populations are clustered together, if the virus is introduced and there aren't really the kind of the mitigation strategies of distancing and protection and washing hands, then bad things may happen. Quick comment, if virus falls in your food and it gets cooked, will the heat destroy it? In this case, I'll say yes. If you actually boil the virus, it's probably not going to survive that. Not that we want to drop any virus into our food. Blood clot busting drugs to treat coronavirus. And I wonder if that comment might be not so much that it's going to get rid of coronavirus, but the notion that some people with advanced coronavirus infections are experiencing clotting. And if we've heard of young people that might experience a stroke, a neurologic event where there's interruption of the blood flow up to the brain, that the issue might be that when you get very serious infections, and it's true for COVID-19 as well as other serious infections, sometimes the blood clotting system goes way haywire and you may end up clotting in different ways. Compound that with very, very sick people who may be stuck in bed for prolonged periods of time, where there's also prone to blood clotting happening. So sometimes clot busters are used in those sorts of settings to treat some of these complications, not the virus itself. The other angle on this is that for some people that might have had a heart attack, some of you will remember that 20 years ago, the main therapy for treatment of heart attacks was to give clot busting drugs to reopen arteries. These days, we tend to be using angioplasty, stenting, balloons, these sorts of things more directly. But if those services aren't available to us for whatever reason, then sometimes the cardiologists have wondered that giving the clot busting medications might be a reasonable alternative because it doesn't need all of that extra instrumentation and everything. So that's where clot busting might come up. Okay, I'm going to go for 3 more minutes. Are ventilators being used less for treatment, but rather putting the patient prone or other types of mechanical devices? So this is a very knowledgeable question about how do we help people breathe? And there was a huge emphasis on ventilators, machines that would push air into lungs and then allow the lungs to deflate and just keep doing that back and forth. And when there is lots of concern that there might not be enough ventilators in the world or in certain states like New York, people were looking at other ways of helping people breathe better. And it was actually interesting that one of the things that was known from people that work with people with lung conditions, that sometimes lying on your tummy as opposed to lying on your back allows the chest and lungs to work better. So that's why putting people face down might be a good way of helping people, and using other types of devices to help with breathing. Some people would have looked at the devices that many people use to manage their sleep apnea at nighttime, and folks are wondering if that might be a way of kind of substituting or being the intermediate between needing a full ventilator versus something else. And I think there have been very innovative solutions that have been used elsewhere. Next question up, should we be washing all fruit and vegetables with soap and water as soon as we bring them into our home? And I think our cardiac patients have said yes, or I'm sorry, our dietitians have said yes, that's probably a good idea, just a little bit of soap and water. And that's probably just good practice all the way around, and you'll feel better for it. And if you're not doing it immediately when you're bringing them home, then certainly before you're going to use them, say you're using your lettuce or your tomatoes or your cucumbers, because I know you're eating all healthy stuff, then that's a great idea. Should we be wearing masks when we go out as cardiac patients? And my answer to you, probably yes, if you're going into places where you're going to be within 6 feet of other people. So if you're going grocery shopping or to the hardware store or to the garden center, and predictably, even though your best intentions are to stay away, people may come into your space, into your bubble. So it's probably a good idea. And the other reason, of course, that we're wearing masks is to protect us from others, but also to protect others from us. And that's kind of the social responsibility thing that we need to get more used to doing. Next question, does a person who's recovering from heart surgery have a chance to recover from COVID-19, or will it inevitably be fatal? And my answer to this is that I think you have a good chance for recovery overall. If you think of the number of people who might have had infections, who are living with heart disease, the vast majority, even those who have heart conditions, have recovered. It's true that if we look for the characteristics of people that had the very worst outcomes, I think you've seen this data, that if you go in not the greatest shape from your health perspective, then the chances of something bad happening are relatively higher. But I think that there are so many people who can do extremely well with your heart conditions, as long as you are respecting all the things that we've been talking about, of keeping your distance, washing your hands, don't touch your face, doing all of those good things. I think you will do very, very well. So let's keep doing all of those great things. And I'm going to do one last question, and then I'm going to answer the other ones in written format as we kind of end from this. And actually, there's 3 questions that are quite similar around immunity and antibodies. That, when you develop your infection, if you happen to have misfortune of getting infection, our body's immune responses to mount these antibodies to fight off the virus. And then you can measure those antibodies early and then later on as signs of immunity. There's lots of interest in antibody testing. And there are some jurisdictions where they're kind of rolling this out, but to my knowledge, there isn't a really great one that's ready for prime time just yet. But I am sure there'll be one really soon. And if you, at some point, we may get into antibody testing as a possible thing to figure out what's actually gone on with our populations. So if you have had the infection. Most people will have an antibody response. At some point, we'll be able to measure that antibody response in your blood as a sign that you've had a previous infection. And for most people, I think the answer is that if you've had it once, you probably won't get it again. But there's no absolutes in this. But that's for the most part. I think that's what the story will be. Thank you very much for joining us today. I hope you've gotten something out of this session. I have, in kind of doing a bit of the background, and I love these rapid fire sessions. So hopefully you found this session to be of use to you. And again, I'm going to apologize that I can't answer everything right now for the sake of time, but I will endeavor to get to these over the next 24 to 48 hours, and we'll get those things posted up. Okay, so great. Thank you very much for joining us. Tomorrow, of course, is Nutrition Wednesday, and tomorrow's topic will be around mindful eating, which is a very important thought as we are living at home, having fabulous nutritional meals, but also being mindful about them. Terrific. Thanks very much, everybody. Have a great day. Stay well and stay safe.